Boswellia is also known as frankincense, and it's obtained from Boswellia trees. Incisions are made in the trunk of the trees to produce exuded gum, which appears as a milk-like resin and hardens into orange-brown gum. There's many Boswellia species and varieties, including Boswellia sacra, and Oman and Yemen, Boswellia cartieri from East Africa and China, Boswellia farina from Somalia, and Boswellia serrata from India. Boswellia resins have been considered throughout the ages to have a wealth of healing properties. Some of the many benefits of Boswellia is it's a great anti-inflammatory, it protects the gut and skin, improves joint function, may support cognition and mental health, and may help with diabetes. Since ancient times, frankincense has been used in Africa, China, India, and the Middle East for the prevention and the treatment of various illnesses, especially chronic inflammatory diseases. Resins from the herb have been traditionally used to treat rheumatoid arthritis and other inflammatory diseases like Crohn's disease. In the Indian system of medicine, it's been used as an anti-inflammatory, anti-arthritic, and an analgesic agent. In traditional Chinese medicine, frankincense is commonly used as a remedy for improving blood circulation and relieving pain. Modern medicine and pharmacology support some of Boswellia's anti-arthritic and anti-inflammatory, heart-friendly, pain-relieving, and liver-protecting properties. There's 4 major boswellic acids found in frankincense that are responsible for the inhibition of pro-inflammatory enzymes. Boswellic acid, or Ba. There's also acetyl boswellic acid, ABA, 11-keto beta-boswellic acid, KBA, and 3,0-acetyl-11-keto beta-boswellic acid, or AKBA. The KBA, or 11-keto boswellic acid, is the most potent anti-inflammatory component of the resin, and it selectively blocks lutrekine biosynthesis by inhibiting 5-lipogenase activity. The AKBA has shown the potential against a large number of inflammatory diseases like arthritis, bronchial asthma, chronic colitis, ulcerative colitis, Crohn's disease, and cancer. Besides boswellic acids, additional triterpene acids isolated from frankincense have also got anti-inflammatory potential. In a clinical trial on 135 osteoarthritic patients, a Boswellia extract significantly improved joint pain and functionality. Patients began to experience significant improvements after 7 days of treatment with a high dose. Different types of Boswellia extracts were able to reduce pain and improve knee function in 3 studies of 145 osteoarthritic patients. Boswellic acids reduce swelling and show anti-arthritic activity in studies on rats and mice with joint disorders. Wound healing, anti-ulcer, and anti-diarrhea properties of Boswellia have been cherished in traditional medicine for ages. Boswellia serrata, the oleogum extract, has antioxidant activity and protects the intestinal epithelial barrier from inflammatory damage. It was effective in the treatment of 30 patients with chronic colitis with minimal side effects. In another trial, the gum resin of Boswellia serrata at 350 milligrams 3 times a day for 6 weeks improved ulcerative colitis in patients with an 80 to 82% remission. In studies on rats, it showed anti-inflammatory and antioxidant effects, inhibiting inflammation in acute colitis and preventing diarrhea. One study showed no superiority of Boswellia versus placebo in patients with Crohn's disease, which is another form of irritable bowel disease though. A cream containing boswellic acids on facial skin led to significant improvements in photoaging, tactile roughness, and fine lines, increased elasticity, and decreased sebum production in 15 women. In another study, a cream with 2% Boswellia extract twice a day for 5 weeks significantly reduced skin redness and irritation caused by radiotherapy. It decreased the need for the use of cortisone cream by 60% when compared with a placebo. In 59 patients with psoriasis, scales, or skin irritation, the same product soothed the skin and improved the symptoms in 50 to 70% of cases. A combination of boswellic acid, betaine, and myo-inositol relieved breast pain and reduced benign breast lumps in a study on 76 women. This treatment also reduced breast tissue density by 60%. In another trial of 64 younger women, the same combination reduced the volume of benign breast lumps by 18% on average. In a study of 44 patients with brain cancer, Boswellia serrata at 4,200 milligrams per day reduced radiotherapy-related swelling with a 60% success rate versus only a 26% from placebo. Administering 3,600 milligrams per day of Boswellia extract 7 days prior to surgery reduced the fluid around the tumor by 70% in 8 out of 12 patients with malignant glioma, which is a form of brain cancer. The signs of brain damage further decreased during the treatment. In another trial, an alcohol extract of the gum of Boswellia serrata reduced brain swelling by 22 to 48%. Boswellia has traditionally been valued for its effect on the respiratory system and has been used in steam inhalations, baths and massages to treat a cough, bronchitis and asthma. Boswellic acids found in frankincense are responsible for the inhibition of leukotriene biosynthesis and therefore may reduce and prevent inflammation in many chronic conditions like asthma. The gum resin of Boswellia serrata improved the symptoms of bronchial asthma, such as difficulty breathing, wheezing lung sound, and the number of attacks in a study on 40 patients. In a study of 75 girls, the extract and powder of frankincense prevented plaque-induced gingivitis, which is a form of gum inflammation. Boswellia is traditionally used to improve learning and memory. It was shown to give significant improvements in visual spatial memory in 80 multiple sclerosis patients, but had no effect on verbal memory and informational processing speed. Boswellia serrata enhanced cognition in a study of 38 patients with nerve injury, but did not significantly improve the overall outcome of their nerve injury. Young rats whose mothers were treated with Boswellia in pregnancy showed improved cognition and an increase in the volume of hippocampal neurons. In a rat epilepsy model, Boswellia extract improved learning ability and eliminated the adverse effects of seizures on cognitive function. In mouse models of brain injury, an isolated compound from Boswellia resin inhibited brain degradation and improved cognitive performance. Boswellia serrata significantly increased blood HDL levels, remarkably decreased cholesterol, LDL, fructosamine sugar, and liver enzymes after 6 weeks in a trial on 60 diabetic patients. In diabetic rats, oral administration of Boswellia reduced blood glucose, cholesterol, triglycerides, and prevented complications in the kidneys and the liver. Boswellia extract prevented the increase of blood glucose levels, prevented pancreatic islet destruction, and consequent hyperglycemia in an animal model of type 1 diabetes. Boswellia serrata significantly increased the pain threshold and pain tolerance in 12 healthy volunteers. Boswellia sacra has shown painkiller properties in different mouse models also. Oral Boswellia serrata consumption reduced the intensity and the frequency of headaches in 4 patients with chronic cluster headaches. Incesol acetate, which is a Boswellia resin constituent, causes anxiolytic and antidepressive effects in studies on mice. Scientists have observed the potential of Boswellia serrata extract to prevent liver injury in one animal study. Non-alcoholic fatty liver disease rats were treated with boswellic acids and they showed improvement in insulin sensitivity and liver function. In chronic hepatitis-associated fibrosis in mice, the combined oral administration of Boswellia and salvia extracts improve the course of the disease. The parasite schistosoma eggs induce liver inflammation, but Boswellia extract significantly reduced these changes in a study on mice. In multiple studies on mice, Boswellia serrata and boswellic acid inhibited the growth and the metastases of colorectal cancer, stomach cancer, and breast cancer. Boswellia and its components were able to kill different types of cancer in test tubes. Boswellia cartieri exhibited mild cardioprotective effects and antioxidant effects in animals with a heart attack. Boswellia showed blood thinning activity in 2 studies on rats. In another rat study, beta-boswellic acid prevented blood clotting and protected blood vessels from injury. Boswellia cartieri and Boswellia dalzieli showed antimicrobial activity against various microorganisms, such as fungi, gram-positive and gram-negative bacteria strains in test tubes. Boswellia serrata gum resin showed antiviral activity against the mosquito-transmitted chikungunya virus and vesicular stomatitis virus in the lab. Boswellic acid prevents as well as reduces the biofilm generation by Staphylococcus aureus and Staphylococcus epidermis. It also exhibited an inhibitory effect on various oral cavity pathogens that were tested. Diterpenes of Boswellia were found active against sleeping sickness, inducing trypanosoma brucei and malaria-inducing Plasmodium falciparum. Boswellia species combat fungi, and Boswellia rvivacis show the best activity against Candida albicans. Boswellia has not shown any major side effects and is considered safe. Possible mild effects could be nausea, abdominal pain, heartburn, and itching. Boswellia has remarkably low toxicity. It's included in the list of safe substances, and its use is permitted by the US Food and Drug Administration as a food additive. Boswellia is even safe during pregnancy and lactation in the amounts found in food, but the safety of therapeutic doses has not yet been evaluated. A repeated oral dose for 90 days in a toxicity study of Boswellia serrata was carried out in rats, and Boswellia was relatively safe up to the dose of 500 to 1000 milligrams per kg. No adverse impacts on health was observed. In a routine toxicity study, Boswellia resin showed moderate to low toxicity on the skin. Boswellia is generally taken as a capsule, tablet, or a bark decoction. The suggested dose for inflammatory or asthmatic conditions ranges from 300 to 400 milligrams of a standard extract containing 60% boswellic acid taken 3 times per day. Several studies note that Boswellia has poor bioavailability and absorption. According to some research, plasma levels of boswellic acid become detectable only when administered with a high-fat meal.